Hi, my name is Amber Terhune, and I'm the health educator for the Johnson County Health Department. This presentation is about heart attacks. So what happens with a heart attack? The coronary arteries narrow due to a buildup of fat, cholesterol, and other substances called plaque, and this process is called atherosclerosis. The blood may clot around the plaque. The plaque breaks off, and platelets rush to the scene, forming a clot, and this further blocks the blood flow. The blood flow to the heart is then reduced or stopped. The heart needs oxygen from nutrient-rich blood to survive. If it is starved for oxygen and nutrients, this leads to ischemia, which is damage or death to the heart muscle. The surrounding vessels may expand to compensate for the blood flow. This all leads to a heart attack. Someone in the United States has a heart attack about every 40 seconds. A heart attack, though, is not cardiac arrest. A heart attack is a circulation problem where the blood flow is blocked. Cardiac arrest is an electrical problem from abnormal or irregular heart rhythms. The heart malfunctions and then stops beating suddenly. A heart attack can cause cardiac arrest. Some terms to know when discussing heart attack include acute coronary syndrome, or ACS, and this is where the blood supply to the heart muscle is suddenly blocked. ST elevation MI, or STEMI, is a complete blockage in a coronary artery. Non-ST elevation MI, or non-STEMI, is a partial blockage in a coronary artery. Unstable angina is where the blood supply is restricted, and this can lead to a heart attack. Myocardial infarction is a medical term for heart attack, and this is where there is permanent damage or death of a heart muscle from a blood supply blockage. Coronary thrombosis is where a clot formation is in an artery that conducts blood to the heart muscle. And coronary occlusion is coronary artery obstruction that hinders blood flow to some part of the heart muscle, and this causes a heart attack. Causes of heart attacks include coronary artery disease, or CAD, and this is where there is a blockage due to a buildup of fat, cholesterol, proteins, calcium, and cells, which form plaque in the arteries. Plaque is hard on the outside and soft on the inside. Coronary artery disease can weaken the heart muscle over time and lead to heart failure. Another cause of heart attacks is a severe heart muscle spasm. This is where the artery narrows and the blood flow decreases or stops. It can occur at rest and in those without significant coronary artery disease. Causes of the heart muscle spasm can be through tobacco and illicit drug use, can be due to emotional stress or pain, and can be due to exposure to extreme cold. Another heart attack cause is spontaneous coronary artery dissection. This is rare, and it's when there is a spontaneous tearing in the coronary artery wall. There are many risk factors for heart disease and therefore heart attacks. Some are uncontrollable, some are modifiable, which can be treated or controlled, and some are contributing factors. One risk factor is increasing age. Men 45 and older and women 55 and older or after menopause are at greater risk. The majority of those who die of coronary artery disease are age 65 and older women are more likely to die than older men. Men, however, have a greater risk of having a heart attack and having a heart attack earlier in life. Children of parents with heart disease are more likely to develop heart disease, especially if their father is diagnosed before age 55 or their mother is diagnosed before age 65. There is a higher risk among African Americans, Hispanics, Native Americans, Pacific Islanders, and Asian Americans. Some autoimmune conditions can increase your risk as well. Tobacco use is a risk factor for sudden cardiac death for those with coronary artery disease. It damages the heart and blood vessels. Nicotine raises blood pressure, and carbon monoxide reduces the amount of oxygen in the blood. Secondhand smoke can increase your risk as well. High blood cholesterol is a buildup of fatty deposits on artery walls which cause blockage. Blood cholesterol is impacted by smoking, high blood pressure, age, sex, heredity, diet, and activity. High blood pressure increases the heart's workload, and this thickens the heart muscle and it becomes stiffer. There is an even higher risk when it is combined with obesity, smoking, high cholesterol, and diabetes. Having preeclampsia or high blood pressure during pregnancy also increases your risk. Physical inactivity usually coincides with obesity, high blood pressure, and high cholesterol. Engaging in regular, moderate to vigorous activity helps reduce this risk. Obesity is excess body fat, especially around the waist, and this increases the risk of heart disease. It is usually associated with high cholesterol, triglycerides, high blood pressure, and diabetes. Diabetes is a high risk factor as a sugar can stick to arteries. Those with diabetes typically have other comorbidities that place them at higher risk as well. At least 68% of those older than 65 with diabetes die of some form of heart disease. Some of these risk factors occur together, called metabolic syndrome, and that places you twice as likely to develop heart disease. Individual response to stress may also be a risk factor. Alcohol can raise blood pressure, increase the risk of cardiomyopathy, raise triglycerides, and produce irregular heartbeats. Men should have no more than 2 drinks per day, and women should have no more than 1 drink per day. Illegal drug use can trigger heart muscle spasms. Diets high in saturated fats, trans fat, sodium, and cholesterol is also linked to heart disease. Food can affect your cholesterol, blood pressure, diabetes, and weight. You should know the signs and symptoms of a heart attack. The most common symptom is chest pain or discomfort. It lasts more than a few minutes or goes away and comes back. It can be in the center or left side of the chest. It can be described as a pressure, squeezing, fullness, pain, tightness, or heaviness. It may be mild or may be severe. You can also have upper body discomfort, which can be pain or discomfort in one or both arms or shoulders, in the back, neck, jaw, or stomach. You can also have shortness of breath with or without chest discomfort. Some other symptoms include breaking out in a cold sweat, nausea and vomiting, indigestion or heartburn, lightheadedness, dizziness, weakness, fatigue, or anxiety. Women are more likely to have shortness of breath, nausea and vomiting, fatigue, back or jaw pain. Some people may have no pain at all, and this is called a silent heart attack. Their first symptom may be cardiac arrest. Symptoms may be sudden or may develop over hours, days, or weeks in advance. If you normally have some of these symptoms already and you notice an increase or change in your current symptoms, you should seek immediate medical attention. So what should you do if you believe you or someone else is having a heart attack? The first thing you should do is call 911. They can give you instructions of what to do while waiting for help. Once emergency services arrive, they can begin treatment immediately. Have someone drive you if you do not have access to emergency medical services. Only drive yourself if there are no other options, as this only puts you and others at risk. If nitroglycerin is prescribed, take it as instructed. And take aspirin if it is recommended. It could help reduce heart damage by preventing blood clotting. It could, however, interact with other medications, so only take it if it is recommended by emergency medical personnel or by your doctor. There are many tests that may be done to diagnose a heart attack. You will also have a physical examination performed as well. You may have an electrocardiogram, also called an ECG or EKG. It records electrical activity of the heart through electrodes on the skin. Injured heart muscle does not conduct electrical waves normally. It may show that a heart attack has occurred or is currently in progress. It can tell how much damage has been done and where in the heart. Blood tests are done to check for heart enzymes, which leak into the blood when the heart is damaged. They can determine the size of the heart attack and about when it started. A chest x-ray may be done to check the size of the heart and blood vessels and look for fluid in the lungs. An echocardiogram may be performed as well. Sound waves are directed through a transducer on the chest to process video images of the heart. It can help identify areas of damage if the heart isn't pumping normally or pumping at capacity. A cardiac catheterization includes a catheter being inserted into an artery through the groin, arm, or neck, and liquid dye is injected. This can check for blockages and can measure blood pressure in the heart, the strength of the blood flow, and collect blood samples. An angiogram is commonly used during a cardiac catheterization. X-rays monitor the blockage and blood flow with the dye injected. A stress test may be done as well. You can have an exercise stress test on a treadmill or stationary bike while attached to an ECG, or you may be injected with the drug to simulate the exertion. The stress test measures how the heart and blood vessels respond to the exertion. A cardiac CT or computerized tomography may be done. You lie on a table, an X-ray tube rotates around the body to collect images of the heart and chest. This can diagnose heart problems and the extent of damage. Cardiac MRI or magnetic resonance imaging may be done as well. This is through the magnetic field in a tube-like machine. This creates images of the heart to look for damage. There are many treatment options available for a heart attack. Time is tissue. With each minute that passes, the heart tissue loses more oxygen and it may deteriorate or die. The goal is to restore blood flow quickly. One option is coronary artery bypass graft surgery, or CABG. It may be used at the time of the heart attack or later to improve blood supply. This creates new passages around blocked arteries for blood to flow to heart muscle. You may also have angioplasty. It can also be called percutaneous coronary intervention, or PCI. Special tubing with an attached deflated balloon is threaded up to the coronary arteries. You also have an option for a laser tip catheter. Both can open a blocked artery. You may also use this procedure to place a stent. Artificial heart valve surgery replaces abnormal or diseased heart valve with a healthy one. An atherectomy is similar to angioplasty, except the catheter has a rotating shaver on the tip to cut away the plaque. Cardiomyoplasty is experimental, and this is where skeletal muscles are taken from the back or abdomen for the heart. You may also have a heart transplant to replace a diseased heart with a healthy donated human heart. Another option is radiofrequency ablation. A catheter with an electrode at the tip is guided through the veins to the heart muscle to destroy selected heart muscle cells in a small area. A stent procedure is where a wire mesh tube is placed during angioplasty in an artery to prop it open and restore blood flow to the heart. You may also have transmyocardial revascularization, or TMR. This is where a laser drills a series of holes from the outside of the heart into the pumping chamber. There are many medication options as well. The goals of medication are to break up the clots, prevent platelets from sticking to the plaque, stabilize the plaque, and prevent further damage. Options include anticoagulants, which are blood thinners to prevent clots. Some examples of this may be heparin or warfarin. You can also have an antiplatelet agent, which prevents platelets from sticking together to prevent blood clots. Examples of this may be aspirin or Plavix. You can have an angiotensin-converting enzyme, or ACE inhibitor. This lowers the level of angiotensin II, which expands the blood vessels and decreases the resistance and allows blood to flow more easily. This lowers blood pressure and reduces the stress on the heart. There's also angiotensin II receptor blockers. It prevents the angiotensin II from having any effects on the cardiovascular system to keep the blood pressure from rising. There's also angiotensin receptor neprilysin inhibitor. This limits the effect of neprilysin, which is an enzyme that breaks down natural substances that open narrowed arteries, to increase the effects of substances and improve blood flow, reduce sodium retention, and decrease the strain on the heart. You may also be given a beta blocker, which decreases the heart rate and cardiac output, which lowers blood pressure and makes the heart beat slower and with less force. It can also limit the amount of heart damage and prevent future heart attacks. They may also do a combined alpha and beta blocker. This can be used during a hypertensive crisis or in an outpatient setting for those with high blood pressure if they are at risk for heart failure. Another option is a calcium channel blocker. This interrupts the movement of calcium into the heart and blood vessels, which decreases the pumping strength and relaxes the blood vessels. You may also be given a cholesterol-lowering medication. This lowers the cholesterol and therefore lowers the chance of heart disease. Another option is digitalis preparation. This increases the force of the heart contractions, which is good for heart failure and irregular heartbeats. You may be given a diuretic to rid the body of fluid buildup. This relieves the heart workload, rids the lungs and other body parts of extra fluid. Oxygen therapy may be used to ventilate deprived tissue. Pain relievers may be given to ease discomfort. Morphine or nitroglycerin. Nitroglycerin treats the angina and can also work as a vasodilator. Thrombolytic therapy may be used. This is clot-busting medication that is injected to restore blood flow in a coronary artery. It is usually administered within a few hours of a heart attack. A vasodilator may be used to relax blood vessels, which increases the supply of blood and oxygen to the heart and reduces the heart workload. They may also use dual antiplatelet therapy, or DAPT, and this is a combination of aspirin and a PTY12 inhibitor, which prevents blood clotting, and it may be used for the rest of your life. Heart attacks have about a 15% fatality rate. Other complications may include arrhythmias, which are abnormal heart rhythms, and these can be serious or even fatal. Symptoms include fluttering or palpitations in the chest. You may also develop heart failure. A large amount of damage may prevent the heart from adequately pumping blood. This may be temporary or permanent. Symptoms include shortness of breath, fatigue, and swelling of the feet, ankles, legs, or abdomen. The heart may also rupture in damaged areas, and this can leave a hole in part of the heart, and this is often fatal. You can also have valve problems, as valves may be damaged and they can develop leakage problems. Life after a heart attack. It can take several weeks to heal. The time depends on the extent of damage as well as your own personal rate of healing. Discuss with your doctor when it is safe to return to normal activities. Your heart forms scar tissue to heal. It does not contract or pump as well and may be weaker. Your heart degree of function depends on the size and the location of scar tissue. You may be on sustained medication treatment. Always know your medications and keep a list and take them always as prescribed. Be sure to go to your follow-up appointments. Your doctor tracks your recovery and works with you to prevent another heart attack in the future. Be sure to keep a list of your doctors and their contact information. You can also participate in cardiac rehab. It helps you focus on medication, lifestyle changes, emotional issues, and returning to normal activities. It provides education, counseling, and exercise training. You should get support as well to help with emotions such as fear, anger, guilt, or depression. Talk with your doctor, family, friend, or a counselor. Be sure to manage your risk factors. There is no cure for coronary artery disease, so you'll need to make lifestyle changes. The goal is to keep your heart healthy and reduce your risk of another heart attack. About 20% of those 45 and older will have another heart attack within 5 years of their first, and the symptoms may not be the same as the first time you experienced a heart attack. Here are some ways to prevent heart attacks. Stop smoking or don't start. Maintain a healthy weight, as this prevents any undue stress on your heart. Monitor and control your blood pressure. It should be checked at least once every 2 years if there is no history of high blood pressure or any other heart disease risk factors. It should be checked more often if you have a history of high blood pressure. Have your cholesterol checked at least once every 5 years. It should be checked more frequently if you have any personal or family history of high cholesterol. Manage your diabetes, as high blood sugar is damaging. Be sure to monitor your blood sugar regularly. Maintain an active lifestyle. Regular exercise helps improve heart function. The Surgeon General recommends 2.5 hours of moderate intensity exercise per week for adults. Children should get 1 hour of physical activity every day. This also helps control other risk factors such as weight, diabetes, cholesterol, and blood pressure. Get good nutrition, such as a diet low in saturated fats, trans fat, cholesterol, and sodium, and one high in fiber. Manage your stress, and go to regular medical checkups. Discuss any concerns or questions with your doctor. Your doctor can perform routine tests to check for conditions even in the absence of symptoms, and take all medications as prescribed. Manage any current risk factors you have and take steps to prevent any future risk factors. Many risk factors can be controlled through diet and exercise and medication. A heart attack can occur at any age. Those over 40 or with multiple risk factors should pay closer attention. As a precaution, whether or not you've had a heart attack, always keep a list of medications, doctors with contact information, and emergency contact information. This concludes the heart attack presentation. If you have any questions, please call your doctor, or if you are experiencing any symptoms of heart attack, please call 911. Thank you.